Today, I am going to be presenting my research on the molecular mechanisms of the Coxsackie and Epstein-Barr virus-induced myocarditis. So I chose to research this topic because I was just intrigued on how these viruses can severely affect the heart muscle in certain individuals while leaving others largely unaffected. And I just wanted to explore this at a higher level. Also, I'm from Georgia. Yeah. Okay, so before I talk about how exactly those viruses can cause myocarditis at a molecular level, I'd like to define what is myocarditis. So cardiomyopathy is a broad term for any disease that affect the heart muscle, and myocarditis is one of them. It's also called inflammatory cardiomyopathy because it involves the inflammation of the heart muscle, specifically the myocardium, which is a middle muscle layer of the heart. Myocarditis can either be acute, meaning that it occurs suddenly and only lasts for a short period of time, or it can be chronic when the inflammation doesn't ever really go away or when the symptoms frequently return. So as you can see in this picture, it kind of shows what a healthy heart looks like and what myocarditis kind of looks like. So in the picture, you kind of see the second layer of the heart muscle kind of inflamed as compared to the regular healthy heart. So patients with myocarditis can experience chest pain, fatigue, swelling, irregular heart rhythms, or shortness of breath. So the most common cause of is a viral infection, though it can also be linked to bacteria, toxins, or autoimmune conditions. Treatments do depend on the cause and severity, but many cases often resolve by themselves. If medications are needed, they usually focus on reducing the pain and supporting the heart with medications such as the anti-inflammatory medications aspirin, ACE inhibitors, or beta blockers. So, anti-inflammatory medications work by reducing the body's inflammation response. So, normally, whenever your body detects an injury or infection, the immune system releases chemicals that causes the blood vessels to widen and attract immune cells to the affected area. This can be helpful for fighting off any infection, but in conditions like myocarditis, it can be severely harmful and it can damage healthy heart tissue. So, what is Coxsackie B virus? So, Coxsackie B viruses, or CBVs, are one of the most common viral causes of cardiac inflammation, and they often lead to myocarditis. Symptoms of infection include fever, rashes, joint pain, and sometimes gastrointestinal distress. If the infection does not resolve by itself, like it does in most cases, it can damage the heart muscle severely. Um, and in fact, CBVs are responsible for about 25 to 40% of myocarditis or cardiomyopathy cases in children and young adults. The way this virus works is that they damage heart cells either by injuring cardiac myocytes or directly or by indirectly triggering an immune response. So I'll be talking about this more in detail in the next slide, but they usually use receptors to enter the cells and usually replicate within those cells, which can cause tissue damage. And Coxsackie viruses are grouped into two main categories, which is Group A and Group B. So Group A includes serotypes A1 through 22, while Group B includes serotypes B1 through 6. A serotype is essentially a distinct strain of the virus, and it's classified by the distinct immune response that it triggers. Different serotypes are associated with different illnesses. For example, Group B serotypes, especially B3 and B4, are usually found with cases about myocarditis. And usually these viruses are small enveloped RNA viruses, about 20 to 30 nanometers in size. And this is how it can cause myocarditis. So, like I mentioned before, the Coxsackie B virus primarily enters heart cells using the Coxsackie B virus and adenovirus receptor. It's also known by the name CAR, and it also uses co-receptors to facilitate this entry and make it easier for them to enter these cells. Once inside these cells, the virus can cause direct injury by replicating within the cardiomyocytes. These are essentially just like the heart cells in the heart muscle, like the myocardium. And this replication can eventually causes a cell to lyse and eventually die. If a lot of that happens, it can lead to irreversible tissue damage. Additionally, there's also indirect injury, which is caused by the body's immune response. So the immune response attacks infected cells, but it can also damage nearby healthy tissue. Um, the um, the first the first system is an innate system, and this is the first to respond. So certain receptors can recognize this RNA and trigger cytokine release, which promotes inflammation. And later, the adaptive immune system kicks in, where certain T cells can target and kill infected cardiomyocytes. While this does like clear the virus, but it can also cause um, inadvertible myocardial damage to perfectly normal heart cells. And ultimately, myocarditis develops because of both of these processes of infection, the direct viral replication, and immune-mediated tissue damage. Similarly, the Epstein-Barr virus also follows a similar method but slightly different. So the Epstein-Barr virus is part of a viral family, which has been linked to myocarditis. These, unlike the former virus, they're double-stranded DNA viruses, and they're very common within the general population. While it's relatively uncommon, they have been shown to cause myocarditis in patients, and acute cases of heart inflammation have been associated with lymphocytic infiltrates and C-tel markers, which show that the immune system does play a big role in this process of myocarditis. And the progression and outcome can be different from patient to patient. Sometimes the symptoms do resolve on their own. In other cases, the damage is permanent and can even be fatal. And specifically, I'm pretty sure you've heard of like the herpes, but the EBV is part of the herpes family, and it doesn't always just end with like a one-time infection. It can reactivate later on, and this has been shown by the presence of EBV encoded RNA. So this is a process of infection for EBV. So the Epstein-Barr virus can cause myocarditis through a method similar to the chain of infection. So the entry point, so EBV enters through the mouth and the throat, and it mainly targets B lymphocytes, endothelial cells in the throat, and cardiac myocytes. And these viruses don't really have to, they can remain dormant and reactivate later. And once they do start producing like once they do replicate within these cells, it can trigger inflammation in the heart. And like I mentioned before, the symptoms can be mild and resolve by themselves, or it can be severe. So, in conclusion, persistent viral infections and the resulting inflammation can cause fibrosis and cardiac remodeling, which may impair the heart's ability to function properly, and it can lead to heart failure in certain patients. While patient outcomes can vary, some individuals can recover fully or partially, while others develop chronic myocarditis or dilated cardiomyopathy. That's why it's really essential to recognize this disease early on to prevent serious complications. And myocarditis can result from complex interactions between the virus and the host immune system. And understanding these molecular mechanisms is critical for um, developing targeted therapies. And I think future research should focus on uncovering the specific viral and host factors that drive myocardial inflammation, as well as identifying new therapeutic strategies that could potentially reverse this. And by doing so, we can improve prevention, diagnosis, and treatment of myocarditis. And that would ultimately lead to better outcomes for affected patients. And that's it. That's all I have for today. Thank you.
Wow, that was that was amazing, Ritika. Let me just do okay. Yep. Can you guys hear me? Make sure I unmuted myself. Okay, we got a question from the audience. So, how is the Epstein-Barr transmitted? You mentioned through the mouth. Is it airborne? Question mark or foodborne? Question mark.
So it's mainly airborne and it travels, it's usually most commonly found in clinical settings, such as like hospitals or something like that. And it's airborne and it can also be transmitted through like any sexual intercourse or anything like that. And it's commonly associated with like the herpes virus family. So yeah.
Awesome. Thank you. There's another question from the chat. What was the most unexpected thing you learned in your research?
Um To be honest, I didn't really like know like when I was first researching on this topic, I was like really like the reason I was so interested in it is because I didn't know that the myocarditis or like inflammation of the heart could be caused by a virus. And I found that really interesting. So yeah.
Awesome. And then last question here is what was the hardest part of your research process?
For me personally, like there was a lot of like complex, I think for starters, there was not a lot of like articles or like
Mhm.
anything like really about it because they hadn't like really researched myocarditis at that time. So it was hard to find anything about it. And also when I did, there were often like complex terms I didn't really like know about initially. And I was able to overcome that partially because of my mentor. He like kind of helped me like understand those terms and like learn what they meant.
Wow, that's great to hear. That's so great to hear. Well, congratulations. This was very informative, and we thank you for putting so much work, time, and effort and into your presentation.